So what I'd like to do is now think about it from the perspective of these diagnostic tools. What will it take for them to become incorporated into common clinical practice? And what are some of the barriers they face? But also, what are some of the benefits they bring to the table and how that might help them as they try and make their way forward in the marketplace? So in terms of an outline, I'd like to start first by reviewing some of the important developments in the IO biomarker space, alluding to the different technologies that are coming into play, just so we're all level set on what's going on there. Then I wanted to focus on some development and commercialization considerations. So what does the marketplace look like, and what are some of the needs in the marketplace? And then we'll talk about reimbursement and market access. It's an important question. A number of you in the previous survey were the pre-meeting survey asking questions about how reimbursement market access might work for this. This is an area of expertise for Boston Healthcare, so I'm happy to weigh in on that. And then also provide some case studies talking about PD-L1 and via immunohistochemistry, but also the recent approval back in April of MMR-MSI for Keytruda, and then kind of launch into NGS tumor panel profiling is another area that is very relevant here. Finally, I'd like to outline some scenarios in terms of where we think the marketplace for IO testing may head into, and what are some of the important things for innovators that are interested in this space to be able to improve their position and help develop a testing scenario that worked well for all parties. So I'll start out by reviewing some of the biomarker developments. This is actually fascinating just because of its accelerating complexity. So very quickly we've gone from having individual tests with maybe one test modality, immunohistochemistry, now to multiple drugs. Very often these drugs are being explored and used in combination. The drugs are being looked at for different indications. So you have different types of cancer that they may be applied to with varying success in terms of the therapeutic efficacy in the various trials they're executing. The tests themselves, there's quite an array of different technologies. Even if you focus on immunohistochemistry, there's different tests and different antibodies. So is it the DACO version? Is it the Ventana version? What are we looking at? You can look at different thresholds for positivity. How do you call someone PD-L positive or negative? Maybe it's 50% in one case, 1% in another case. And then now we're seeing the introduction of different technology platforms, liquid biopsy, arrays, FISH testing, CTCs. These are all different things that are being interjected into the oncology testing paradigm. And if you layer that on top of kind of global differences in clinical practices and lab practices, the way they get funded, the policies they execute, the evidence of development is occurring, it's a very complex environment for the oncologist to sit there and say, what is the right test for me? To specifically focus on the IO space, I want to highlight 5 different technologies that I'm interested in. Now, I bet people on the line are probably also interested in a number of other things as well, but I just want to highlight some of the main ones that are being talked about. And these range from what I already alluded to, the PD-L1 IHC expression levels, immunohistochemistry, that's probably the most well-known diagnostic application in the IO space. But then also you have interest in microsatellite instability or gene mismatch repairs that could be accomplished by a ProMega approach or Ventana DACA approach. There's also a lot of discussion now about tumor mutational burden, TMB, and that's emerging as a quantitative marker to show potential levels of TMB associated with IO response, which may be a cross-cutting diagnostic modality. There's a lot of interest in gene expression profiling, notably I've seen several talks by Ken Emancipator at Merck, who's highlighted the ability, and also folks at NanoString are talking a lot about this in terms of using gene expression as maybe a different way to assess IO response patterns. And then now digital pathology as well. So the idea of not only is it sufficient to do a grind and find modality of taking the tissue and analyzing its DNA, but maybe what we need to do is also look at the tumor microenvironment. What kind of context is it in? Do we need a multiplex imaging modality to assess not only the presence of antibodies or biomarkers, but also where they're located? And we hear about some of this in discussion around neoantigens. So it's just a fascinating array of diagnostic modalities. So one of the core questions for our discussion today is, will all of these move forward equally? What are some of the challenges that they'll face in terms of commercialization? What are some of the benefits that they bring to the table? And how will they secure market access? So we'll want to look through these and try and do a little forward-looking exercise of trying to figure out how will this all evolve in the future.